With the end of year coming up, it's a perfect time to reflect on all the lessons, growth, and amazing guests we've had on Endo Battery. But instead of one big recap, I'm breaking it into quick, bite-sized reflections multiple times a week. Let's revisit what inspired us, learn what we missed, and recharge together in our Endo Year Reflection series. Join me each episode as we look back. Welcome to Endo Battery, where I share my journey with endometriosis and chronic illness while learning and growing along the way. This podcast is not a substitute for medical advice, but a supportive space to provide community and valuable information so you never have to face this journey alone. We embrace a range of perspectives that may not always align with our own, believing that open dialogue helps us grow and gain new tools. Join me as I share stories of strength, resilience, and hope, from personal experiences to expert insights. I'm your host, Alana, and this is Endo Battery, charging our lives when endometriosis drains us. Welcome back to Endo Battery. As we continue our Endo Year Reflection series, I am incredibly grateful for everything that we've gone through this year. When I think back to episode 160, my conversation with Dr. Megan Wasson from the Mayo Clinic stands out as one of those episodes that answered questions I get asked all the time, and questions many people don't even realize they're allowed to ask. Dr. Wasson is an incredible educator and physician who truly understands the depth and complexity of endometriosis across the entire lifespan. And that matters because endometriosis doesn't look the same at every age, and it doesn't behave the same way either. So many patients want to know, how does endometriosis present in adolescence? How does it change through reproductive years? What happens during pregnancy, perimenopause, or menopause? And honestly, I couldn't think of anyone better to walk through that with me than Dr. Megan Wasson. One of the most important things Dr. Wasson emphasized is that endometriosis can occur at any age. Pregnancy doesn't cure it, hormones don't cure it, menopause doesn't cure it, though symptoms may shift and change over time. She also highlighted something that deserves far more attention. You are never too young to have endometriosis. Adolescents experience it too, and navigating care at that age requires thoughtfulness, caution, and compassion. Dr. Wasson walked us through the challenges of evaluating young patients when traditional gynecologic exams can be invasive or even traumatic. And she didn't just talk about the physical impact. She spoke to what these kinds of medical experiences do to the brain, the nervous system, and long-term trauma responses.
Unfortunately, there's a lot of generational trauma that can almost happen, that because we know there is a familial component to endometriosis, that if mom had endometriosis and really, really struggled with painful cycles, and then her daughter is now starting to have cycles and really struggling, they don't know any different. And so the mom tells the daughter, yeah, this is your cycle. This is just what it is. So there's that huge element that can happen, that the family is normalizing it. Now, if an individual goes and talks to her doctor, most commonly the pediatrician is who is going to be the first sounding board for this, and they say, yeah, I'm having cramps, and the pediatrician doesn't delve into it any further, and they say, well, yeah, everyone has cramps with their period. It gets dismissed, and that's where the cycle starts happening, that patient may never bring it up again because, well, I told my doctor and they said it was normal, so yeah, I guess this is just what it means to be a woman and what it means to have my cycle. And so that's where we need to do better very early.
What I appreciate so deeply was how clearly she explained when care is appropriate, how symptoms may persist at different stages, and how we can advocate for ourselves or our children without rushing, dismissing, or causing harm. I've known Dr. Wasson for about 3 years now, and I can tell you, she is one of the most down-to-earth, intelligent, and passionate endometriosis specialists I know. She's a phenomenal communicator who explains complex concepts with clarity and calm. And despite the very technology struggle we had on recording day, stopping and starting and stopping and starting more times than I can count, you'd never know it by listening back. Her patience, kindness, and steadiness in those moments meant so much, especially knowing how busy she is with surgery, clinic, and research. Over the years, she's become a friend, and I'm incredibly grateful, not just for her expertise, but for her compassion and humanity in the way that she shows up for patients. Another provider who left a lasting impression on me was Dr. Francesco Di Chiara in episode 151. I met Dr. Di Chiara at the Endometriosis Summit, and while I knew cardiothoracic endometriosis existed, the way he explained it, it was unlike anything I'd ever heard before. One moment that truly stuck with me was how he described the rainbow of colors of endometriosis. I had heard that concept applied to pelvic disease, but I hadn't fully realized how the diversity in appearance translates to the thoracic cavity.
So it is my very own classification, and I've noticed that the patterns in presentation of disease are lesions that are pink and sessile. That seems to be the most superficial, together with the brown cauliflower-shaped ones that are very superficial. And when I go at the base, the diaphragm underneath looks, or the pleural looks completely fine. Instead, there are the purple, which are hemosiderin filled. Hemosiderin is like a fancy name for old blood, and white, which is, we all know white is scar. Scar is always the end stage of a very prolonged inflammatory process in our body. So the idea that I haven't proven yet is that this is a pathway or steps to get to the final scarring. Although there are elements supporting my theory and elements not supporting it, I am still thinking that it shows a lot of elements supporting this, and at least it gives some way to approach the disease systemically, in a way that we know what to do.
Dr. Di Chiara is an exceptionally clear and thoughtful educator. He allowed us to really get into the weeds, breaking down what cardiothoracic endometriosis is, how it persists, what symptoms to watch for, and why it's so often missed. He's also an innovator, pushing forward new identification markers, new surgical techniques, and better education not just for patients, but for the medical community as a whole. What stood out most was his commitment to ensuring patients are seen, believed, and treated with dignity. He doesn't accept complacency. He doesn't accept late diagnosis as the inevitable. He wants better for patients and for the field as a whole. And yes, the accent doesn't hurt. It makes learning about something complex a little bit more enjoyable. And you know what else is enjoyable? Having another tool for the survival guide. Here is another tip for your holiday survival guide. Use pain management proactively. Waiting until you're miserable is overrated. Don't do it. These two providers are powerful reminders that passion and compassion are what drive real change in medicine. They are constantly pushing boundaries educationally, clinically, and relationally so patients can get diagnosed earlier, treated more effectively, and supported with respect and kindness. I'm deeply grateful that I've had the opportunity to sit in the conversation with both Dr. Wasson and Dr. Di Chiara to learn from their wisdom, to grow through their perspectives, and to share their voices with this community. As we continue to look through the year, I hope you'll listen with openness and curiosity. You may hear something new. You may connect a dot that wasn't clear before, and you may find that an episode you missed or didn't fully absorb at the time is exactly what you need now. Thank you for being here. Thank you for reflecting with me, and thank you for continuing to come back to these conversations where learning, compassion, and advocacy meet. We'll keep moving forward together, one meaningful conversation at a time. Until next time, continue advocating for you and for others.